Hi, this is Dr. Dan Margolin of New Jersey Foot and Ankle Center, doing the next in a series of most commonly asked questions. This one relates really to low back pain and knee problems. Many times I get patients that come in and associated with their foot problem are knee problems or lower back problems, and they don't really understand how that is possible. So let me just explain it. This is a foot that's a little bit flattened, okay? And as we see, as a foot flattens, it loses stability. It's not as stable as it would be if it were higher. When a foot flattens, now what will do that is just genetically you're born with a flat foot, or some people's arches fall over time, but again it loses that stability. The main function of the foot is absorbing shock. If it is losing stability, if it is not absorbing shock, what happens is the next joint up will. That will either be the ankle, the knee, or the lower back. And many times we find people with feet that flatten or pronate have associated knee problems and low back problems. So what do we do for treatment? Many times the treatment is what's called an orthotic, or a support to stabilize the foot. It goes in the shoe. You don't see it. It actually feels very comfortable, but it doesn't allow the foot to come over, and by doing that we actually stabilize the knee and the lower back. We find that between 20 and 30% of lower back problems are actually related to an arch that has fallen or a foot that is not as stable as it should be. This is Dr. D. Margolin bringing you the next in a series of most commonly asked foot problems on knee and lower back problems. Thank you for joining us.